Yes. So we are live on the YouTube. We'll wait for a minute or so. Let others join.
Morning, Satish.
Good morning, Jagdish.
How are you?
Good to see you.
Good to see you too.
Good morning, Jagdish bhai.
Good morning.
Yeah, Saturday morning. I mean, this makes your day because you have darshan of two Jagdishis in the morning. Okay, so it's 4 minutes past 8. Let us start the meeting. So, good morning, friends. Welcome back to Saturday Club of Baroda. Somebody has two devices. It's echoing. Anyway, can you hear me well? Kiran bhai, can you hear me?
Yes.
Okay. So we start the meeting. Today we have our very veteran, member of Saturday Club of Baroda, Dr. Kiran Shah, who has been delivering talks at this club very regularly, even before this online era. So hardly needs any introduction, but just to say it formally, he's a senior consultant physician, Vadodara, and has 3 decades of experience. He's director of Spandan Multi-Speciality Hospital and has several presentations at national and international conference. And recently, we must all congratulate him for getting fellowship of Indian College of Physicians, which is a branch of API. So congratulations, Kiran bhai. Welcome.
Thank you for your.
Welcome back to Saturday Club of Baroda. And he's going to tell us about overview of Epicon 24, which is his, I would say, signature presentation every year. After he attends this national conference, he gives us a brief review of such conferences, and we always look forward to it, Kiran bhai. So welcome back to Saturday Club, and please go ahead with your talk. We'll have about 40-45 minutes, and if you think that some parts are remaining, we will have it part 2 later on in the. So please go ahead.
So good morning to everyone. Let me share my screen. So first, I would like to say that it is a good morning to all my respected seniors, colleagues, friends, and all those who are attending. And so, okay. Yes. So good morning to everyone. Today I am going to have a talk that is Epicon update in short. Overview of the Epicon 2024. This conference is rather, I would like to say that API is one of the biggest, largest body. Just a minute, sorry. Is the largest body as far as the health care segment is concerned in India, which has a nearly 22,000 membership. And there is always an annual conference at different places in India as well as in the nearest countries. So this time this conference was held in New Delhi, that is our capital city, and it was the 79th annual conference of the Association of Physicians of India, which was held in New Delhi in the venue that is a Bharat Mandapam, IECC, New Delhi. It was held from 22nd to 25th February 2024. Regarding, let me tell you about something about this venue particularly, because it is a new for us. The venue of Epicon 2024 was the state-of-the-art Bharat Mandapam. It is the one of the largest edition in the prestige of Bharat, which was also used for holding G20 summit recently, that you might have, everyone has experienced this. and probably some of you might have visited this particular, but it itself is a tourist place, rather we can say. And I say that you must see this particular place whenever you are visiting this particular New Delhi. This Bharat Mandapam is being one of the structure which is being managed by the it is also known as the International Exhibition Cum Convention Center, that is IECC, and it is being designed at the Pragati Maidan, New Delhi. And this place was inaugurated by Honorable Sri Pradhan Mantri Narendra Modi on 26 July 2023. And this new venue is a large exhibition and convention in the city of New Delhi, India. It has an area of nearly 150 acres of exhibition space, being among the biggest exhibition centers in India. The IECC venue is managed by the India Trade Promotion Organization, that is ITPO. It is situated in the heart of the city, that is Pragati Maidan. And recently it has been renovated in view of the G20 summit being hosted by India. And Epicon was held in this particular structure. It is magnificent venue and has a state-of-the-art facilities. There are several halls and committee rooms, an amphitheater as well, and a large area for the exhibition and dining. The venue, what I had told you itself, is a tourist attraction for the delegates who were already attended this particular Epicon. So it was a really nice, and I once again tell you everyone that you please visit this particular place. Some of the glimpses of this particular, that it is an area near the Pragati Maidan, and there are several gates. This was the gate number 6. And this is one of the most important structure of G20 summit. This particular G20 summit was held in this particular building. And our exhibition or our conference was also held in this particular building. The Epicon was inaugurated by our chief guest, and that is the Honorable Sri Jagdish Dhankar ji, the Vice President of India. This was the opening ceremony picture. And one of the most important function of this Epicon, that is annual convocation ceremony, that is wing of API, that is Indian College of Physicians, which was inaugurated by Dr. Jitendra Singh, the minister in the central cabinet. These are some of the pictures. And the gala dinner was another important event in this particular Epicon. And the banquet dinner was arranged on 24th February 2000 at the Enchanting Cricket Ground of the Major Dhyan Chand National Stadium, which is very just stone throwing away from this particular Pragati Maidan. During this particular Epicon conference, there were 2 books released or published in this Epicon that everyone you must know that it is a signature, rather we can say that publication of API. These 2 books are, one is a Progress in Medicine, that is a 2024 volume 34. It is an official publication of the ICP, that is Indian College of Physicians, which is an academic wing of the Association of Physicians of India. And second one was a Medicine Update 2024 volume 334, that is part 1 and 2, which is an official publication of the Association of Physicians of India. This book, actually 2 parts of Medicine Update, comprises more than 280 articles, which is written by distinguished faculty based on their top topic deliberations. It serves as a reference book with updated knowledge for almost all physicians, undergraduates, as well as postgraduates too. So it is a very, very important books for almost all. It is also considered as a textbook. Now, the theme of this Epicon 2024 Delhi was clinical to digital medicine. And let me tell you that there are a lot of important things which was in this particular conference. That was, and based on that particular thing, the theme was given, name was given, that is clinical to digital medicine. That's right from the registration onwards to everything, there was digitalized. There was only a barcode was given to every delegate, that is nowadays routine for each and every conference. And from barcode, you can access everything. Second thing, a mobile application was also launched in this particular conference. Via this particular mobile application, you can participate in any hall. I think 8 or 9 halls were there in this particular Epicon conference venue. And you can access conference of any room or any theater where you want to attend. And at the same time, you can participate at whatever quiz is going on in whatever hall was that. That is the digitalization of this conference. There were a lot of oration lectures, particularly 7 oration lectures, which I would like to tell you the name. That is, one is Dr. V. Parmeswara Lifetime Achievement Award. It was awarded to Dr. Vijay Singh from Varanasi. He has delivered a talk on molecular landscape in myeloproliferative neoplasm. There are another important orations were Netaji oration, Dr. G.S. Sainani oration, and Dr. Siddharth Shah oration. This Netaji oration was awarded to Dr. Sarita Bajaj from Allahabad, and he had delivered a talk on the diabetes and lung carcinoma disorders, mechanism, consequences, and treatment considerations. And Dr. Pinaki Mukhopadhyay was awarded Dr. G.S. Sainani orations, and Dr. Siddharth Shah oration was awarded to Dr. Rajesh Sharma from Ahmedabad, and he has delivered talk on 10 commands when in ICU care. Another three awarded, that is oration lectures was given by Dr. P.J. Mehta oration, that was Dr. Jaya Chakravarti from Varanasi, my experience in infections. Then Dr. Professor Rathanya Velu Subramaniam endowment oration, that is awarded to Dr. Jugal Kishore Sharma, and he has talk on manifestation of autonomic diabetic neuropathy and their evaluation. And lastly, Dr. V. Parmeswara Lifetime Achievement was awarded to Dr. Rajesh. There are a lot of workshops and panel discussions were also there. Nearly 16 workshop and panel discussions were there. Writing based research paper, that is research methodology, intra-articular injection, obstructive airway disease, lipids, propylene, data management for internists, communication skills, biological and chemical, as well as nuclear warfare also. So this NPCon conference was full of updated knowledge, in which was comprised of lectures, panel discussion, workshops, oration lectures, and quizzes and everything. I had attended one of the important workshops that is my area of interest, and that is the research methodology, which is held on 22nd only, and that was in the session 2. That was panel discussion titled Scientific Paper Writing, Planning, and let me have a marker. That is a scientific paper writing. That is was a moderate speaker was Dr. Mark Johnson, and 2 moderators were Dr. R.S. Dhaliwal and Dr. Mrunal Kranti Das. And also it was moderated by, or panelists were Dr. V. Mohan, Kameswar Prasad, Dr. Justin Paul, and Dr. Tina. In short, it was very nice workshop. And the title was Research Methodology, Writing a Research Protocol. I would like to tell something about this particular thing because it is a very important area of my interest. The physician, why we are lacking certain type of research work and data from India. And for that also it is very important. The physician must know important. This actually was in collaboration with the PRF, that is a Physicians Research Platform, which is an important wing of the Association of Physicians of India. This conference was historically very important, since for the first time there was an address from the director PRF, that is Physicians Research Forum. Also, for the first time, an hour and 20-minute session under the aegis of PRF on research methodology was taken place in this particular session. In this session, panelists were, that is what I had told you, that Mark Johnson from Imperial College London. Panelists and moderators were Dr. Wonder and Dr. Dhaliwal, and other panelists were Dr. V. Mohan, Justin Paul, Tiny Nair, and Thiruvananthapuram and Chennai. This is Dr. Dhaliwal, Dr. Wonder, and all these panelists. Just the point particularly discussed in this particular workshop, that how to have a correct research question, means how to generate a particular research question in your mind. That is most important thing. If you want to carry a research, there has to be some generation of question in your mind, and how to go in this particular uh, uh, thing you want to go ahead. Then the correct methodology to be used, that was also discussed. Then ethical clearance that are required nowadays for everyone. You must know that whenever you are publishing or anything you are doing research work, the ethical clearance must from a national or local ethical clearance committee. Then method of registration with the clinical trial registry. So every paper or research must be registered with the clinical trial registry, that is CRI, also known as CRI. Then how to go for the statistical analysis to be done, and correct way of scientific writing. These all points were discussed very nicely. And in conclusion, what they have told us that whenever someone is the beginner or start writing paper, start with the case reports and retrospective or prospective case series. That is one of the important thing. Whenever you are starting or doing some sort of research work, start with the case report only. That is very important. Then go for the retrospective or prospective case series. For first case report, then case series. Then go to observational registries, depending on what problem and disease you want to look at. So second thing you can do is the observational registries. Third thing, how to conduct randomized control trials. And fourth thing, how to participate in multicentric trial. So these the stepwise approach what they had suggested for any beginners in, if you want to participate or if you want to do the research. Now coming to the scientific contents, particularly in this Epicon conference, that is what I had attended and what I learned from this particular conference. That is, let me tell you about first thing is the non-communicable disease. In this non-communicable disease, you already know that they are now having the global epidemics everywhere. We can see that in India also, we are now having a global epidemic of non-communicable disease and not the communicable or infectious disease. So we are heading towards a non-communicable disease epidemic, that is diabetes and hypertension. Among these is the most important thing. So in this particular thing, diabetes related insulin resistance was discussed, particularly very important. So you all know that insulin resistance is a topic of hot discussion everywhere across the globe. And Dr. L.H. Gotekar, he is an endocrinologist also. He is a director, profession head, Department of Medicine, Department of Neurology at the Lady Hardinge Medical College in New Delhi, India. He has delivered a very nice talk in Is Reversing Insulin Resistance a Myth or Reality? And in this particular lecture, he has given us a very, very important topic, very, very important knowledge about this particular, what is the exact mechanism, how we can deal with this particular insulin resistance, how this insulin resistance is the root cause of type 2 diabetes mellitus, what are the mechanism of exactly this insulin resistance, and what are the remedies for this insulin resistance to combat, that is whether it is a non-pharmacological or pharmacological. And from that, now we are talking about from remission to reversal of type 2 diabetes mellitus. We will go particularly in this particular topic in detail, whatever I have learned. So diabetes is a global epidemic, as you already know, happening as a global pandemic on an unprecedented scale. According to International Diabetic Federation IDF data 2021, there are nearly 537 million adults who are living with the diabetes, and another 547 million adults are at increased risk of developing type 2 diabetes mellitus. Insulin resistance has various metabolic effects on human body in the form of hyperglycemia, that it causes diabetes. It also produces hepatosteatosis, polycystic ovary, atherosclerotic events, and obesity-related cancers like endometrial cancer also. He clearly told as what we know so far, and on evidence recent advances in both lifestyle intervention and pharmacotherapy. So very clearly he has told about the lifestyle intervention as well as the pharmacotherapy, how to come back with this particular insulin resistance. This may help turn back the clock on resistance. So these are the insulin related disease in the humans that are, or you already know, right from atherosclerosis, that is arthritis, heart cardiomyopathy, then adipocyte, obesity, pro-inflammatory state, then glucose intolerance, that is type 2 diabetes mellitus. Then at the liver, there it produces steatohepatitis, steatosis, as well as cirrhosis also, and NAFLD, that is non-alcoholic fatty liver disease. But now the terminology has changed, and that is metabolic associated fatty liver disease. Also, it produces some lesions at the central nervous system, that is impaired energy homeostasis, and disturb brain development, that is Alzheimer's disease. It has also roles in Alzheimer's disease. Certain cancer also, it has been related or directly linked with this particular thing, insulin resistance, that is breast, uterus, cervical, and endometrial cancer. Then CKD also, there is some link, and polycystic ovary syndrome also. So these are all insulin related disease in humans. So which is a very important topic which we have discussed. Probable underlying mechanism in insulin resistance are direct defective insulin signaling, epidemiological factors, inter-organ metabolic crossings, metabolic mediators, genetic mutations, epigenetic dysregulation, gut microbiota dysbiosis, and like that. Not going into the much detail, there are certain molecular mechanisms responsible for insulin resistance in type 2 diabetes mellitus are there. One of the most important is the insulin resistance in the muscles, events in the liver, renal contribution, vascular intervention. So those all are interlinked. Finally, postprandial hyperglycemia ensures due to increased hepatic glucose output, muscle insulin resistance, and excessive renal glucose reabsorption. Other potential mechanisms for insulin resistance were endoplasmic reticulum stress, that is reactive oxygen species IORS, and inflammation, proposed to explain the mechanism responsible for obesity-induced insulin resistance as well. Medications for insulin resistance, which was also he has discussed very nicely, which are the medications and which are the non-pharmacological interventions for insulin resistance. These are the clinical medications to improve the insulin resistance. That group is the biguanide, particularly metformin, thiazolidine, pioglitazone, lobeglitazone, and GLP-1 receptor agonist, that is liraglutide, particularly exenatide, semaglutide, DPP-4 inhibition, that is sexagliptin, vildagliptin, alogliptin, sulfonylureas, particularly newer one, that is a glimepiride, and PPAR gamma agonist, that is also. So in this particular segment, he has put more stress on this thiazolidine, that is TZDs, for improving the insulin resistance. And you must be all aware that pioglitazone is nowadays not much used because of its side effect, that is particularly related to fluid retention and leading to the heart failure. And newer molecule, which is nowadays we are using, is lobeglitazone. This lobeglitazone is a newer molecule, and there are a lot of studies in favor of this lobeglitazone is now available, and it is also available in the market also. So there is some difference between pioglitazone and lobeglitazone. Pioglitazone is less sensitive, less efficacy, and produces more edema, whereas this lobeglitazone is more efficacious and less edema. That is what is the difference. And you already know that pioglitazone or lobeglitazone works by improving insulin sensitivity at the PPAR gamma levels. So this lobeglitazone is a newer molecule, and it is already available in the Indian market. He has also discussed how to diagnose this insulin resistance, and we are also having now enough laboratories to have this insulin resistance diagnosis. Basically, we are diagnosing with the help of glucose intolerance test, that is GTT, or nowadays we are testing it with the HOMA-IR or HOMA-IR model, which is already available in Vadodara also. So the take-home message, particularly in this non-communicable disease talk given by Dr. Gotekar, is that don't give up. As per the ADA, there are effective tactics to combat insulin resistance. Losing weight, exercising more, taking insulin sensitizing medications can help you get back to the good blood glucose control and better health. So, resilience, not hesitance, is what will help us in insulin resistance. That is what is most important message he has given. In line with this particular non-communicable disease, another important topic which was covered by Dr. Sanjeev Kumar Sarpa, that is an associate professor of the VP Koirala Institute of Health Science, that is in Nepal. He is eminent endocrinologist as well. He has told us very well about the reversal and not the remission, about the lifestyle related disease, that is diabetes mellitus, non-alcoholic steatohepatitis, and hypertension. I think 1 or 2 years back, Dr. Chennappa Jagdish Bhai is already there. So I would like to tell that time I have a query in my mind that it is not reversal but remission. But nowadays the reversal terminology has already been used, and now we are getting the reversal of this lifestyle related disorders particularly. So he has, in this particular talk, he has given us a very good hint about how to deal with these lifestyle-related disorders with the help of non-pharmacological interventions. Dr. Gotekar has given us pharmacological interventions, and Dr. Sanjeev Kumar Sharma has given us a very good talk about this non-communicable disease, that is a lifestyle-related disease, and how to deal that particular diseases with the help of non-pharmacological interventions. We already know that these lifestyle-related disorders occurs because of the unhealthy habits, particularly lifestyle medicine interventions, particularly helpful in this particular thing. So these habits, or whatever we know that unhealthy habits, are particularly unhealthy food habits, increased physical activity or less physical activity, particularly stress management and social support, and could also possibly reverse these LRDs. So these are unhealthy food habits, physical inactivity, stress particularly, and lack of social supports are main reason for increasing LRDs, and we can deal with this particular non-pharmacological interventions, that is insisting for more healthy food habits, increased physical activity, stress management, and social development, and this could possibly reverse LRDs. Some supportive evidence is what he has given us, as that he has also deal with what are the pathophysiology of this LRDs, that is lifestyle related disease. In his talk, he has discussed very nicely, that is regarding the New World Syndrome, that you already know, that is a part of these LRDs in particular group, that is because of the modernization as well as urbanization. Then also he has discussed the twin cycle hypothesis, that you already know, that is responsible for the insulin resistance. Cigarette smoking, how it is producing the oxidative stress and endothelial injury, and also he has discussed about the alcohol consumption and oxidative stress. He has also discussed the role of yoga, exercise, and reduction of oxidative stress. He has also discussed the gut microbiota and reversal of metabolic syndrome. Sleep pattern and lifestyle disorders also was discussed in his talk. And particularly, he has given some of the evidence, reversibility of lifestyle-related disorder. Say, for example, like lifestyle-related diseases are diabetes mellitus. In this, he has quoted regarding the DIRECT study, that is Diabetes Remission Clinical Trial Study, in which we already know that they had insisted for very low calorie diet, somewhere around 600 to 800 calorie per day, and low carbohydrate diet. And he has also given example that now we are having a complete reversal after the bariatric surgery, particularly when we are dealing with the obese patient and diabetes. And if you do a bariatric surgery, yes, it is possible that we will get a complete reversal of this diabetes. He has also discussed about the non-alcoholic steatosis hepatitis, that is also LRDs, and how to have a reversal, particularly in this particular non-alcoholic steatohepatitis disease. He has clearly told that whenever there is a more than 10% weight loss, it is beneficial in reversing not only steatosis, but also it is helpful for steatohepatitis, LS, to some extent fibrosis also. He has also told how to have a reversal, particularly hypertension when it is related to hyperinsulinemia and obesity related. There is a link between this particular. So overall, he has very nicely discussed this particular topic. Now going into the immunology, particularly topic. In immunology, this Dr. Pankaj Kumar Agrawal, very specific lecture. What is most important in that this particular topic is that he has delivered entire lecture in Hindi. For the first time at the national level, I have heard that talk is given in Hindi. His talk was on anti-thyroid antibodies. Do we misuse it or not? So he is from the Ghaziabad. He is a consultant endocrinologist at the Hormone Care and Research Center. And this is particularly his topic, that is anti-thyroid antibodies. Do we misuse it? You can see that the lecture hall was full of jam-packed hall. Because particularly what I can say that he has delivered this topic particularly or lecture in Hindi. That is main thing what I have seen in this particular. He has also published or circulated this particular talk in 5 or 7 pages also. An entire talk was written in Hindi. So we are now going more and more towards local language use in particularly medicine. The conclusion of his talk is that thyroid antibodies we already use in particularly the diagnosis of thyroid related disorder, but how to use, when to use, that is what most important thing he has told us. That in conclusion what he has told इस प्रकार थायराइड एंटीबॉडीज को बिना जाने हुए प्रत्येक रोगी के इनकी जांच कराने की कोई औचित्य नहीं होता है. He has told clearly that everywhere, if we are unable to diagnose or there is some doubtful in the thyroid TFT thyroid function test, you should not go for the everywhere thyroid antibodies. There are only limited usefulness of this particular thyroid antibodies, and where it is useful, hypothyroidism particularly. हाइपोथायराइडिज्म में सब क्लिनिकल हाइपोथायराइडिज्म की डायग्नोसिस के समय टीपीओ एंटीबॉडी की जांच जीवन में केवल एक बार ही करानी है. मींस देयर इज नो नीड फॉर डूइंग इट repeatedly, particularly in hypothyroidism when we are going to diagnosis or when we are dealing with the subclinical hypothyroidism situations. So in subclinical hypothyroidism, and whenever we are getting the level particular between 5 and 10, and there are some confusion, we are usually going for these thyroid antibodies. And in these thyroid antibodies also, particularly you should go for the TPO antibodies, that is thyroid peroxidase antibodies, and not all other antibodies. So if this thyroid antibodies is high at the beginning along with subclinical hypothyroidism status, yes, it is useful. We can predict that this patient may need thyroxine therapy or not. In hyperthyroidism, particularly when there is a Graves disease, to diagnose उसके के लिए TSI, that is thyroid stimulating immunoglobulin की जांच कराई जा सकती है. यहाँ लंबे समय के उपचार के पश्चात इसे यह जानने के लिए इसे दोबारा कराया जा सकता है. मीन्स इन दिस पर्टिकुलर कैटेगरी, yes, we can go for the second time to know how it is progressing or not. That is in thyroid Graves disease along particularly in hyperthyroidism. So important antibody to be done is TSI and not TPO. Another important TPO antibody की जांच गर्भधारण की इच्छुक महिलाओं में इनफर्टिलिटी होने की संभावना तथा गर्भावस्था में बार-बार एबॉर्शन के होने की संभावना का अनुमान पूर्व में ही लगाया जा सकता है. गर्भावस्था में GDT मिलने, ग्रेव्स डिसीज मिलने पर TSI की जांच द्वारा शिशु में गोइटर या हाइपोथायराइडिज्म की संभावना का अनुमान भी लगाया जा सकता है. So these are the two important things: when to do TSI and when to do TPO antibody, how to repeat it and when to repeat it or not. Another important thing what he has told is the thyroid carcinoma. So whenever you are dealing with the thyroid carcinoma, and if there is a total thyroidectomy, after total thyroidectomy, if you want to evaluate this particular patient, it is not only the thyroglobulin, which is, but along with that, you also go for the thyroglobulin antibodies, which will be very helpful in early diagnosis of the recurrence of these particular things. That is a thyroid cancer. So in this particular 4 segment and in this particular situation, only you should go for these thyroid antibodies, and you should not always ask for all thyroid antibodies everywhere. This Dr. Pankaj Agrawal has a medical concept in Hindi, that is type of institution. He has almost published many good Hindi books also, that is medical concepts in Hindi. Is an institution also known as MCH, that is medical concepts in Hindi. Another important topic which I had attended in this particular Epicon is the infectious disease. In infectious disease, what is the most important topic of discussion is that is the adult immunization. Even though it has already been discussed so many times in this particular platform also, I had attended this particular adult immunization workshop, that is a workshop as well as panel discussion. And this panel discussion was in support with the GSK, that is company. The topic name was adult immunization, whether it is need or want. And moderator were R.K. Singhal, Satyavrata Ganguly, Prabhat Pandey, and panelists were Dr. Agam Vora, Susila Kataria, and Vivek Nagina. They had discussed this particular topic very, very nicely. And particularly, they had put a more stress on, and another important thing, it was held in this big amphitheater, and you can see that the hall was fully jam-packed hall, and so it suggests that that is a topic of this interest to everyone. In this particular workshop, they had particularly put a more stress on the India Adult Immunization Survey. That is why there is a need, or whether it is needed or not in India particularly. So they had particularly quoted this India Adult Immunization Survey, and this survey was carried out by the one is API, that is Association of Physicians of India, and in partnership with the IPSOS, that is the marketing and research company based on Paris, that is France, and it was supported by the GSK. So this survey was carried out in January 23 to March 23, and it was held. Survey was held in 16 cities of India itself, and Surat was one of the city which was included in this particular city. Nearly 2,000 people and doctors were screened in this particular, or surveyed in this particular survey, and the findings were a significant number of doctors say that they do not discuss the vaccines with the aging adults because of the cost. However, only 37% of the aging adults associate adults vaccines with unaffordability. So the important finding is that 86% of the doctors say that they do not discuss with the vaccines with the aging adults because of the cost. But at the same time, only 37% of the aging adults associate adults vaccines with unaffordability. So this is a real contrast. Again, among the doctors surveyed, 91% believe that adult vaccination is important for healthy aging, but have recommended vaccines to only 16% of adults above 50 years, of whom 63% of have comorbidities. So these are really contrast things what we have come out with the survey. So probably that is unawareness regarding this particular thing, and so we must increase the awareness. A large number of adults, that is 63%, and their caregivers, that is 76%, do not ask doctors about adult vaccination because they believe that doctors would recommend vaccination if they needed it. So these are the important findings, particularly in this particular survey, and we must look into this particular survey and improve ourselves as well as. So he has also discussed age-related susceptibility to infectious disease, make vaccination a cost-effective public health strategy. So particularly here, we already know that now adult vaccination is very important as far as the herpes zoster, pertussis, influenza, pneumococcal, hepatitis, and diphtheria tetanus. What are the advantages of this adult vaccination? Decrease burden and severity of the infection in the most economically productive group, reduce incidence of development of antibiotic resistance, protection from disease of vulnerable group, that is immunocompromised, cancer patients, pregnant females, and elderly. Development of herd immunity in the population which prevents spread of the disease, decreased number of sick day lives, unvaccinated individuals may serve as carriers or chains of transmission of this particular disease. These are the summary of adult immunization guideline. I think everyone knows and it is available everywhere, particularly influenza, streptococcal pneumonia, human papillomavirus, herpes zoster, diphtheria, pertussis, tetanus, measles, mumps, and rubella. And these are the vaccine doses recommendations. Not going into the table, which is easily available everywhere. So this is the immunization schedule, that is tetanus, pneumococcal, influenza, hepatitis B, herpes zoster, that everyone knows. 1 dose for tetanus after reaching 60 years, pneumococcal vaccine, that is 1 dose after 60, booster after 5 years, influenza once every year, hepatitis B 3 doses, and herpes zoster 2 doses after reaching 60 years. So the most important thing or conclusion is that adult vaccination is the need of our awareness and education. Apart from putting guidelines into practice and firm belief in the effectiveness of this adult vaccination are the key to prevention of infectious disease. Now coming to the nutrition part. That is what important thing. In this particular thing, that is, I think, last topic. So we'll finish it in time, I think, which I have covered in this particular Epicon update. That is artificial sweeteners in diabetes, what we must know. That is delivered by the Jitendra Singh. This Jitendra Singh is the assistant professor of the general medicine department in the Institute of Medical Science, that is Banaras Hindu University, and he says delivered talk on these artificial sweeteners, what we must know, because this is also an topic, hot topic of discussion everywhere. Particularly, he has covered artificial sweeteners, what is the guideline says, what the authority says, what are the available literatures, and what review literature says about these particular artificial sweeteners. These artificial sweeteners, you already know that it is also known as non-nutrition sweeteners, that is NNS. They do not raise blood sugar levels. Who recommended total amount of added sugars should be kept to less than 10% of total calorie intake. And if it is ADA, they recommend that it should only be 6%. So this is a very important recommendation, that who recommended total amount of added sugars should be kept to less than 10% of the total calorie intake. In this particular thing, these artificial sweeteners are very useful because they do not raise the blood sugar level. As far as we know, these artificial sweeteners are so many artificial sweeteners are available. That is saccharin, aspartame, neotem, advantam, asulfame, potassium, sucralose, and cyclamate. Of this, Indian authority has permitted almost all except this cyclamate. So almost all these artificial sweeteners are available in India. They are 0 calorie particularly, except this aspartame, which may give or some small calories, that is important. It is already been approved by US FDA also. So all these things are available in Indian market. What are the controversies and what are the present situation that we will discuss? Though this is a very poor slide, but I will be able to read it. American Diabetic Association in 2013, ADA, and in ADA 2023 stated that the use of non-nutritional sweeteners as a replacement for sugar sweetened products may reduce overall calorie and carbohydrate intake, as long as there is not a compensatory increase in energy intake from other sources. So in 2023 ADA and in 2013 American Diabetic Association, they have clearly stated that it is useful as long as you restrict energy or you do not compensate energy intake from other sources. So there is very important statement. Another important statement from ADA is that the American Heart Association AHA 2012 and the medical care standards for diabetes that in 2018 agreed with this assertion that when used judiciously, this NNS may facilitate reduction in added sugars and energy intake, help people achieve and maintain a healthy body weight, and lower the risk of cardiovascular disease and type 2 diabetes mellitus. But in controversy, what are other statements is that according to the American Heart Association Nutritional Committee 2018, consuming more artificially sweetened drinks was linked to a higher risk of stroke, coronary heart disease, and all-cause mortality. Online Nutrinet cohort 2020, the total amount of artificial sweeteners consumed was linked to an elevated cardiovascular risk. And these findings imply that the outcome of cardiovascular disease is not improved by replacing added sugars with artificial sweeteners. So, in conclusion, what Dr. Jitendra Singh has told that NNS are still being debated not only for increased cardiovascular, cerebrovascular, cancer incidence and mortality, but also for their potential to cause health problems such as renal toxicity, genotoxicity, neurotoxicity, and disruption of the gut flora. But remember that all these subsequent studies has debunked these particular myths. So nowadays in 2023, it has been clearly stated that all these artificial sweeteners, whenever we use in moderation, it is safe. So particularly in India, we should use. And in contrast, Dr. Bansi Sabu has stated that he has given us a very clear-cut statement that is in India, particularly from 2000 to 2010, there is increased consumption of the sugar, that is added sugar. Particularly, initially we were consuming in 2000, we were consuming nearly 20 grams sugars. And nowadays, we are consuming about 55 grams per day in 2010. So, in India, at least a 151.3% increase in white sugar consumption per person per day was reported from 2000 to 2010, which amounted to nearly 55 grams per day in 2010, while 22 grams per day in 2000. So, high intake of dietary sugar has led to an increased incidence of obesity, cardiometabolic disease, including diabetes, hypertension, and CVDs. And use of these non-nutritive sweeteners is an effective strategy to replace dietary sugars and reduce sugars and caloric intake. So NNS has been approved for use as a good food additive by various regulatory bodies such as the Food and Agriculture Organization, the World Health Organization, EFSA, etc. And clinical evidence suggests that NNS is effective in weight control, diabetes management, and prevention of risk of the tooth caries. Safety evaluation of NNS has revealed that NNS consumption is safe for use in the general population, including pregnant and women and in children. So in 2023, as far as India is concerned, we in moderation should use this NNS as far as possible to replace this calorie intake. The recommended use of this steviol glucoside is 4 milligram, steviol equivalent kilogram per body weight, aspartame up to 40 milligram per kg body weight per day, and sucralose up to 5 milligram per kg body weight per day. So this is a very clear-cut message from this topic and talk that artificial sweeteners are very useful in our Indian setup. Particularly, we want to cut down the calorie intake, carbohydrate intake. So I think this is all what we can discuss in this Epicon.
Excellent, Kiran bhai. Thank you for giving a real overview. Have you covered all topics, or we can wait for another part 2 also?
I think I had covered what I have attended this time.
Okay, fine.
Okay, so we had covered almost all.
Yeah, please share, stop the screen sharing.
Okay.
We'll have some discussion.
Okay.
I understand there will be a lot of questions. So we go ahead and start with the question answer session for next 5-7 minutes. Please go ahead. Anybody who wants to ask questions.
I wanted to ask about reversal of hypertension, Kiran bhai.
Yes, particularly
Okay.
reversal of hypertension when it is linked with the hyperinsulinemia and obesity. In this particular segment only, he has told that if you stop the smoking, yes, to certain extent, when there is a hyperinsulinemia as well as obesity associated with this smoking, hyperinsulinemia and obesity, yes, it is possible to reverse this hypertension, not in other segment.
Not in the segment, right.
Kiran bhai, about adult immunization, we pediatricians have been promoting adult immunization.
Yes,
So
sir, that is what I have
our
told.
own Baroda colleague, Dr. Tushar Shah and Dr.
Yes,
Abhay
yes,
Shah from Ahmedabad, they have edited a book on adult immunization.
yes.
So my question is general to all physicians that how far are you ready to immunize adults, or we pediatricians should take up the responsibility?
I think I had also heard and I had also attended that Tuksar's lecture he has had specifically arranged for us also. And from that only I had this time Epicon. I went particularly for this particular topic and attended. And
Right.
I realized that it is very really the need of an hour. I fully agree with you that, and we should encourage such type of immunization center, adult immunization center at our level also. I fully agree with you. We should
At least
encourage.
awareness building should be done at your
Yes.
point. We may continue to give because we are sort of very much involved in immunization programs, being pediatricians. So you can at least make the adults aware, and if you are not comfortable conducting this vaccination programs at your own place, you can refer them to pediatricians for getting the immunization done.
Fully
And
agree.
will not steal away your patient, definitely.
Okay, right, fully. We were thinking still now we are thinking about the cost, but as you particularly see in this particular survey, it has clearly contradicted our myths.
Yes.
Kiran bhai, adults who once had a herpes zoster already, should they go for vaccine again?
Yes, it is always recommended that is herpes zoster is not a disease which will not recur. So whenever there is a herpes zoster, after 3 months, they always insist that you should go for the vaccination.
Yes. Jagdish bhai, if you are not taken, I would recommend that you should.
I have not taken. I had herpes before 20 years. That's why I asked that particular question whether I should take.
As he said, recommendation is for all. Everybody, even have history of having.
Now Amitabh Bachchan is doing advertising everywhere in the TV and everything. You should recommend. He himself has taken or not, I don't know. But yes, he is recommending. GSK particularly is very important, particularly company which helps in.
Costly vaccine and very reactogenic also. I mean, you get knocked down for a couple of days. So
yes, at least for 3 days you should have. At least for 3 days.
Yeah, if anybody is planning, I would recommend it to take it on Friday or Saturday.
Yes,
so you won't be able to work well for next couple of.
So Jagdish bhai Chinnappa, last time I think 2 years back you had asked me this query regarding the remissions and reversal, but now the reversal is possible and we had already having this particular important trials as well as some evidence regarding this particular diabetic and insulin resistant. So you are having a far ahead in knowledge of this particular thing.
I have a couple of comments. I think the wonderful overview, and I really congratulate you for showing us the venue. I'm sure all of us will visit the venue.
Yes.
And I wanted to request you for 2 things. One is if you can send us the reference of that adult immunization survey, because it will be useful for creating at least some material for patients to know. That is one point which I thought was very interesting.
Mhm.
Second, which I was very taken aback, was this presentation in Hindi. Because I think if there is no simultaneous translation, a large part of the candidates are not very conversant with Hindi. So then it will also lead to other complications. Like, will JAPI magazine allow a publication to be in Hindi? Especially if it is going to...
This
And
publication not in the API textbook. That is definitely so.
No, the journal. If you allow this kind of thing to take place, then tomorrow the publications may come in Hindi like they have in Chinese, and then after that you will have no regulation. So I think the point is, when they start the conference, they should have a clear mention of the conference will be conducted in which language. Because they should not allow other languages. Otherwise, tomorrow somebody from Tamil Nadu will come and say, I will speak only Tamil. Say, nobody will know what you are talking about. So these are rules which the organizers should make very clear right at the beginning. That the language should be there. And plus, yours is such a great organization. There will be a lot of foreign delegates. And you will have difficulty. This is I think this kind of thing should be looked at a little more carefully before.
I think they always mention that the official language of this conference is English, always that. But how this has they had allowed it, or I really don't know. I had not gone in much detail of this. But what I had seen for the first time, I had just enumerated.
Yes, sir. I agree. And I think thank you very much for that insight into the current recommendations on diabetes management. So many things are happening, and especially now with this new semaglutide and others which are coming in, how it is going to change the entire spectrum of not only diabetes but NCDs, obesity, and even Alzheimer's and other kidney disorders is going to change rapidly in the next couple of years. So I think that
is a game changer. Yes, definitely.
Yes, it is going to change everything. So thank you very much for your wonderful overview. I think it was very, very helpful. Thank you, sir.
Thank you for
Kiran, I have to add one comment.
Yes. Go ahead.
While all these medicines and are game changers, being a sleep doctor, all I can say is part of the insulin resistance is bad sleep.
Yes.
So we have to remember that what happens to the body while we're asleep is as important.
Agree that this sleep deprivation is very important factors. Definitely.
And that has become more and more common. Just like the sugar intake has increased, the sleep has gone down.
Yes.
We are lining up a talk by you in the month of May or June regarding
I am not an insulin resistance expert like Kiran.
Particular Rakesh, I think it is at 12 or midnight.
It's 11:30.
11:30. Okay. Fine.
Hemant,
you are awake.
Comment, Dr. Hemant? Yes, please.
I have 2 comments to make. Regarding reversal of diabetes, we all ethical MBBS doctors are fighting the Patanjali type of this thing syndrome where Ayurveda is supposed to reverse diabetes. So we need to balance the metformin used at HB1AC, which is only 6.5, 6.6. That is question number 1. Second question is about adult immunization. There is only a comment. Only yesterday in our oncology group, we had discussed. We had a CME about adult immunization, especially before starting all cancer treatments. But this metformin, which causes lactic acidosis, and a lot of side effects are coming in. And what is your comment on it?
Yes, definitely. Metformin is associated with the lactic acidosis, but if we see the incidence, particularly, it is very, 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 very less. Particularly, it happens when it is also used in combination with the SGLT2 inhibitors. So, when there is SGLT2 inhibitors along with metformin use, the lactic acidosis, whatever is happen, is most difficult situation, particularly in ICU care. I fully agree with you. So but the incidence so far, if we use it, is very less. And if we use it judiciously, yes, there is less likely. So whenever there is use of particularly SGLT2 inhibitors, we always insist that you take at least a fair amount of liquids or plenty of liquids. So such type of things or such type of instruction should always be given to prevent such type of whatever it may be the less than 1% incidence. But yes, you should take care of this particular thing. And along only with metformin, the incidences are very, very less. I think fully agree. But the advantages are far ahead this particular compared to this lactic acidosis. So we always use.
Yes, and thank you for highlighting that modern medicine can reverse so-called diabetes, which we start metformin, and then the other pathies take prednisone for reversal of diabetes. So congratulations for highlighting. We need to spread this message.
Yes, yes. Yeah.
Okay, friends, thank you. We are a little bit overshooting the time.
Okay.
So we meet next Saturday morning again. Thank you once again, Kiran bhai, for
Thank
this
you.
wonderful
Thank you.
overview. We thought that we were in Delhi, you know, with that Mandap, Bharat Mandap.
Yes, I think everyone must. It's a really a tourist place. Everyone must see from inside. This is only one building which I had shown you, but there are so many buildings in this particular integrated complex. Really wonderful, sir.
So
Okay.
thank you all. We meet again.
Thank you, sir. Thank you.
Thank you.
Bye,
Thank
Satish.
you.
Bye. Thank you, Kirit bhai. See you.
Excellent
Bye.
talk.